Hi, doctors. Today we're going to explain the station of Erotomania. I'm going to share with you my PDF. Now, the station of Erotomania is one of the history-taking stations together with risk assessment and also includes psychosexual assessment, which can be a bit challenging for the international medical graduates and in general, and in particular, that it is a new, to some extent, new area to be assessed. So it needs some sort of background about how to do a psychosocial assessment and definitely how to do it in a way which can be assessed without being timid or hesitant. Let's go through the station. In the station, you're going to meet a man who is referred to you because he came without notification to the hospital, asking to see one of the lady nurses. And the security discovered that the nurse does not know him, and you are being asked to talk with him to know what's going on. What is not written in the can is noted that the role player will be totally upset for talking with you. He wants to see her. He believes that she is his girlfriend simply because she offered for him some sort of medical care 3 weeks ago, and since then he believes that there is some sort of chemistry, some sort of relation between them, and he came today to take it to the next step. And he has some plans for her in the weekend, which include an intimate relationship. Also, he has a previous relationship which ended in the police because he has some sort of weird and unaccepted practices in his intimate relations. Also, when you see him, if you are seeing him in the real cask in Sheffield, he will be carrying a bag, and this bag contains a knife, and he will say eventually that if someone would prevent him from seeing her, he might use this knife. All along the station, he will be a bit defensive, and if you are not good in your communication skills, the defensive attitude of the role player can be very challenging to you. So your communication skills will not only help you to pass the station, but also to make the attitude of the role player more helpful for you. So let's go through how we can tackle the station. As I said, it is a history with the risk assessment. And as you know, we don't go through the stations without having a particular plan about how to do this station, and also without having a good time management. You only have 7 minutes, so you must be very careful with what you are going to do. We have 7 steps to cover the task according to this plan. Number one, the introduction, and do not underestimate the step of introduction, and I will come later on about why it is a very important step. And then you have the ABC of the event. Here, the event is the meeting between this man and the nurse, and you're going to assess it in the ABC technique, and we will go through it later on. And then you have the symptoms of syndrome, which is the psychosexual history. Now, the good thing about the history taking task or the history and risk is that the point number 4, 5, 6, and 7, which are the comorbidity, the coping and risk, past history and family history. Definitely delivering the diagnosis differs according to the station. However, the point number 4, 5, and 6, they are all typical questions. You don't change a lot. There's very subtle variation between one station and another. So if you were able to cover point 1, number 1, 2, and 3 in a good way, most probably you have passed the station, okay? So let's go through how we are going to do the station. As I say always, the task is not about the information, technical information. It is about your communication skills, your consultation skills, how you are going to assess a patient without being negative or without having a complaint set against you, or without supporting the patient in order to help him to take the next step in his treatment process. So you must have empathy. Definitely, empathy is very important in your communication skills. And the difficult point in this issue is that if you are an international medical graduate and your native language is not English, it is very difficult to show empathy because your mind is busy with forming sentences. So, as I always say, preparing the task is not by reading the textbooks, it's about practicing. You must practice how to show empathy. Okay, particularly if you are an international medical graduate. Here in the PDF, there are some sentences which will help you to show empathy. You don't need more than 5 or maximum 5 sentences. After all, it is not a psychotherapy session. Just some sentences, 5 sentences maximum, to show that you have good communication skills and you show empathy to the patient. And definitely the best time to show empathy is in the very early part of the station when the role player starts to talk. Definitely when he starts to talk, he will elaborate some emotions. You must show what is called the appropriate reciprocal emotion. And definitely these sentences which will help you to show empathy according to what you are going to hear. So let's see how we're going to go through the station. Number one, the introduction. The important thing about the introduction in this station is that, as you can see, the patient came to you by the security, and he's not happy that he's talking with you, so you must address this. And also, the good introduction will also help you to pass the station. I have this information from one of the consultants. He said that in the afternoon session, the examiners are exhausted. So, you know, if someone is not able to introduce himself in a proper way, if he is not able to greet the patient and address his name in a correct way, or identify himself and explain to the patient why he is talking with him, they don't give him a pass. And to some extent, this is a fair assessment. If you are a psychiatrist and you don't have a good communication skills and you don't even know how to introduce yourself, don't blame someone if he is not keen to give you the membership of the Royal College. Okay, so the introduction is very important. So you just greet him. Simply the introduction is greeting the patient. Hello, Mr. X, then identify yourself. I'm Dr. X from the mental health unit. I've gathered that you want to see one of our colleagues, however, coming without notification to your place and demanding to see one of the employers raise some concerns. And I've been asked to discuss this with you. Are you okay with that? So what did I do now? I just introduced myself and greeted the patient, explained for him why am I talking with him. Okay. And as I said, if you are in the real cask, you will notice that the patient is carrying a bag in his hand. It is part of your ability to assess the risk is to pay attention to these cues. So you must ask him what is in this bag. He will say that it might contain something which is sharp, an sharp object. Ask him simply to put it aside. Otherwise, you might call the security and you will not be able to help him. Just one issue, I just want to share with you my experience regarding this bag issue. Don't assess a bag issue except if there is a sort of risk assessment in the task. I had it before. There was a mental state examination, and the role player actually had a very big bag in the station. And I thought that if there is a bag, I must assess it because it is part of the risk. So I asked him in details about this bag. Eventually, I did not pass. And he was denying that there is a bag, but I didn't understand that the presence of the bag was not in the scenario, and I shouldn't have asked him. So all in all, if there is a risk assessment, ask about the bag. If there is no risk assessment, ignore anything else in the station except the patient himself. Okay, so let's continue. So if you want to continue, if you want to assess the patient, don't go through the details of the relation. There are other ways better than this. I know that there is some sort of videos in the assessment. One of them, which is a native English doctor, was very interrogative with the patient. And actually, one time I adopted this attitude in the task, and I was very interrogative in assessing the patient, but eventually I did not pass. But I adopted another another attitude or another approach, which I'm going to share with you now. And I passed it. I think passed it twice or once. I don't remember. So you start by asking him more about his personal information, and this will help you in different ways. Number one, to appear that you are professional. Number two, it will help you to cover the social information, which is part of the risk assessment, parts of the history taking, and also part of the risk assessment, because we know that if a patient has a job, this will is associated with less risk. If it is a permanent job, also less risk. If he is married or has a partner, also less risk. And if he has a family around him, also all this means that that this is a low risk. And these are important points in the HCR risk assessment. Okay, so start the station by asking him, I would like to start by knowing more about you, and ask him about his job and whether it has been a permanent job or not, and if he is married or has a partner, etc., and if he's living with anyone. Then assess the ABC of the event. And as I said, the ABC of the event is a technique which you can know it in details in my CASC tutorial YouTube channel in the history and risk assessment, but rapidly I will go through this. You assess the history, the event in the ABC by asking him about the event, which is the B. You are going to assess whether what happened, factual information in this event, and then assess the mental state of the patient during the incidents, and then after the incidents, assess the factual information and the mental state, and before the incidents, which is the A, assess the factual information and the mental state. So let's see how we can do this. The incident itself, ask him when, what, where, and if there is anyone was around, ask him about his mental state. So if he felt any sexual arousal during this incident in which he had been giving this type of medical support. And then after the incidents, ask him about the factual information. What happened? Is it okay to ask a personal question? Did he masturbate? Did he try to see her again? Did you try to contact or follow her? And ask him about his mental state. So how do you feel about what happened? And if there is any place for any other explanation, like that she was only doing her job and taking care of you. So this is the incidents and after the incidents. And before the incidents, you want to ask him some information. So how were you doing before the incidents? If there has been any stresses, and you can ask him if he has ever met her before this particular incident in which he has been given this type of medical care. And then we go through the symptoms of the syndrome. And again, this can be a bit challenging for the international medical graduates, particularly if they are female doctors. We know that this is a sensitive issue. We in the Middle East and the Far East, this can be not an easy issue to be open, but they expect from you to be more assertive and be able to cover these sensitive issues professionally and in depth. So how we can do this? So before going through the sensitive details, you can take permission, say, because of the nature of the situation, I would like to ask some personal questions. Okay, and start gradually. Ask him, have you ever been in a relation and how did it end? So this is the first thing you are going to ask about. And then ask him if he has any plans in his mind for the nurse. And ask him how would he describe his sexual life. This means if he has any particular sexual preferences and if he uses anything from the adult shop. As far as I know, that he likes to use some chains, something from the adult shop. And there's a pivotal question, which you'll not find it in anywhere. If he is sexually interested in anything other than an adult female, so if he is a healthy and mentally okay regarding his psychosexual behavior, he will not be interested in anything other than an adult female. A very important question also about the pornography, particularly if it includes children. And I got this question also before from one of the consultant. It is very important to ask if he has ever had an intimate relation with a child, and ask him if his name is in the sexual offender register. It is a register in the UK for all those who have been legally documented as sexual offenders. And finally, ask him about his childhood and if there are any traumatic experiences in the child. Okay, so you will find tens of the questions regarding the psychosexual history. If you want to add more questions, it's okay, but pay attention to the time limit. Okay, we don't want to go through an academic assessment of the psychosexual history. There is no place for any academic assessment or any academic approach in the task. Actually, you only have 7 minutes, so you can imagine the time issue. So there is no place for in-depth academic assessment for any topic. So if you want to adopt these questions, I feel that they are enough and they help me and help many candidates to pass. If you want to add more questions, pay attention to the time issue. Then, as I said before, the nice thing regarding the history taking task and the history and risks, that the points number 4, which is the comorbidity, 5, impact and coping and risk, 6, process and family history, and finally determination. They are all typical questions. So let's see the comorbidity. Okay, we pay attention. Comorbidity means that we are going to dig in the other areas to check if there are any other problems. But here we already covered the social part in the beginning, so we're not going to go through the social part. Okay, we know in the comorbidity, we're going to cover the areas in the biopsychosocial areas. Social is already covered, so I'm going to cover the psychological area and the physical area. Couple of screening questions regarding the mood, and if there is any anhedonia about energy levels, sleep and appetite. Ask him 2 questions about the psychosis, and the physical, ask about the physical problems, and that's it regarding the comorbidity. Impact, coping, and risk is very important. So point number 5 is important, not only because here it is a risk assessment and it is the point related to the risk and assessment, but also related to the time management. Whenever you are in the task of the task and you have a history task or history with risk assessment, if you did not reach point number 5 when you hear the bell of 6 minutes, immediately leave whatever you are doing and start assessing the impact, coping, and risk. Then go through both history and family history and terminate the station. You can hardly cover the 3 points in 1 minute. Okay, so if you did not reach the point number 5, when you hear the bell of 5 minutes, 6 minutes, immediately start assessing the impact, coping, and risk and go through the other points. Okay, so here in this station, we are going to assess the risk and the coping, and just tell him this is a sensitive situation. I'm wondering what would happen if your request to see the nurse was refused. So this is a very important question. And this is the only subtle variation in the assessment of the risk related to this patient. And then the other questions are all the routine questions. How do you cope whenever you are stressed? Do you drink alcohol or recreation? Do you use any recreation drugs? Sometimes stress can bring strange or dark thoughts of self-harm, of life, or life is not worth living. Has this ever happened to you? And how about thoughts of retaliation or hurting someone else? Do you have access to weapons? Any previous legal problems? These are the typical questions of assessing the risk in any stations. We only just added the question related to his request, if his request to see the nurse is denied, what would happen. Other than this, it is a typical, all the questions are typical. Then we go to the past history and the family history. We thank him for all this information, but ask him if this is the first time for him to talk to a psychiatrist and if there is any family members who has been in contact with the psychiatric services before. And finally, terminate the station by thanking him, but make it clear that for the safety concerns, it will be better to inform the police and it will not be feasible to see the nurse. This is how you terminate the station. And if you can cover all this in 7 minutes, it will be more than perfect from my perspective. This is what helped me and what helped many of the candidates which I'm tutoring, whether on the personal level or on the general Zoom sessions. Okay, so I hope that you found it helpful. Let's go through the mark sheet. Again, the mark sheet is very important. It's all about this mark sheet, whether you are using my material or using any other material. Make sure that whenever you practice, you cover as much as possible from the points in the mark sheet. As you can see, this is the history mark sheet of the Royal College. It's from their site. I'm going to just highlight the most important parts in this mark sheet, and I will start by the communication. Pay attention that you have 12 points. 6 of these points are related to the communication, so you can imagine the magnitude of the communication in this examination in general. And these 6 points are typical points in all the stations that don't change, only the technical points which change, but the communication points are the same. So let's see the communication points. The disorganized or unstructured consultation means that if you do not cover one heading in details and then you shift to another heading and you return back to the same heading, okay, this might be considered as disorganized or unstructured. Poor management of the consultation, if I think this related to the time management more. Consultation appears formalic. This is very, very common for the international medical graduates because they just forget the communication skills. Their mind is totally preoccupied by forming the questions. They don't pay attention to what I said, the appropriate reciprocal emotional interaction of the patient, and also the anxiety, which makes the doctors very, very stiff in their attitude with the role player. Number 9 does not show appropriate attitude or behavior. Unfortunately, this is not uncommon because of the anxiety. Many of the candidates might show inappropriate. Their attitude might not be suitable for someone who should be attempting to take the membership of the Royal College. Poor listening skills and poor response to the cues. Unfortunately, this is a very common mistake because, as I said, the international medical graduates, their mind is preoccupied by forming the questions, so they don't pay attention to what the role player is saying. So they miss what the role player is saying and they miss the cues which is put on the table. Finally, these 2 points are, what can I say? Many candidates might find it not justified. As you can see, they are related to the language. If your language is poor, most probably you are going to miss these 2 points. Point number 11, poor questioning style. If your question is is not good and you're not using weaving, you don't put part of the patient's story in your question, most probably this point is going to be lost. And if you want to know more about the weaving, what is weaving, you can watch my videos on the COSC tutorial YouTube channel. And number 12, poor use of the language in the context of the scenario. Again, this is related to the language. I had that the COSC is formulated so that the candidates who are able to pass the COSC should not score less than 7 in the IELTS. I don't know how much this information is valid. However, as you can see, there are 2 points related to the language in the assessment of the candidates, and this is hefty. It's too much. So how we can surpass this problem? Simply, if your language is not good, my language is not good, by the way, and I passed, and many candidates whose language is not good also passed. So what did they do? They had their own notes and they wrote down the questions, good question style. In the beginning, they wrote too much, but with time, they found that they are using the questions, same questions in different stations. As I said, you don't need to formulate new questions, new dialogue for every station. And they practice as much as possible, and they have passed, though their language is average and sometimes below the average. So let's see the technical points. Number one, does not identify issues and priorities. As you can see here, if it is risk, your priority is to assess the risk and the incidence of the risk. Fails to recognize significance of aspects of history. So there are particular information which are going to be given to you in the candidate notes and also which are going to be given to you from the patient. And also there are particular areas which should be covered. And these are the aspects of history which you should cover. Does not elicit the presence of or explore in enough detail relevant to the symptoms in the history. And this is the symptoms of the syndrome, and this depends upon your knowledge. And as you can see, the knowledge about the task does not cover more than 1 point. So maybe you are not very oriented with the particular problem, but you can pass eventually. Does not demonstrate adequate skills in risk assessment. From my experience, the doctors who do not pay attention to the skill, to the risk, whether it is any station in the course, their passing is not be guaranteed. They like safe practitioner, and the point of risk is there in all the technical points. Number five, does not pay sufficient attention to the patient's physical and health view. If you involve the patient in your conversation, you don't have the authoritative approach. Unfortunately, this is our approach in the Middle East and also in the Far East, that we have some sort of authoritative approach in our talking with the patient. We don't have this sort of dialogue with them, and they don't like this in UK. They like those who pay attention to the patient physical and health view. They involve the patient in the dialogue. They talk with them. They try to make the information more clear with them. They make sure that the information is clear, and this will help you to pass point number 4. Point number 6 is related to the psychological and social information, and most probably this point might be lost because the social information is missed from the candidates. So most of the candidates, they ask about psychological, but they miss the social information, which is related to his life circumstances, if there's any stressors, anyone around him to support. So 3 questions, typical question, will help you to make sure that this point is not going to be lost from you. I hope that this presentation is helpful. If you feel that this PDF is helpful, you can download it from my site, www.casktutorials.com. And if you feel that you need for extra help, tutoring and coaching, also this can be arranged from my site. And thank you.